Hey kids, it's Bill, the knee pain guru. We're live. We are going to answer some knee pain questions. It's been a minute since I've done one of these, maybe a week-ish. But anyhow, we had some questions building up, and I figured I needed to get in here and answer them. Okay, welcome to those that are showing up on the live stream. If you have questions about your knees, whatever your knee situation, put those in the Okay, I'm not sure what happened. I don't even know what that looked like on your end, but all of a sudden everything disappeared. Um, Wait a minute, we don't want that. I got to remember where I'm at. Okay, questions, put those in the live chat. I'm going to dig into the questions that were sent in. These came over other YouTube videos and through the Knee Pain Guru website. So I'm going to dig in right now. First question came in from Peter. This was from the Knee Pain Guru website. I had my quadraceps tendon repaired after a rupture. Is there anything in your program that covers this injury? Generally, I have no pain, just discomfort and a small lack of range of motion, but figure that scar tissue may still be an issue. Surgery was 14 months ago. Yes. Short answer, yes. The program will help with scar tissue. Now, where the scar tissue is, doesn't matter. If it's in your thigh, if it's in your knee, if it's in your shin, if it's in your calf, if it's in your hamstring. Scar tissue is scar tissue. The elements of breaking down scar tissue to increase range of motion with or without pain. You know, you don't necessarily have to equate what's going on in the scar tissue as pain. It could be uncomfortable. It could be tight. It could be tender. It could be whatever it is, because we're looking deeper into the body as in terms of what's going on. This is all, everything you're struggling with is an expression of the neurology of your body, the nervous system. In order to increase the range of motion, break down the scar tissue, get a more comfortable range of motion, we have to look at the underlying piece, which is the neurology that's causing the body to tense up and give you that experience. Does that make sense? If it does, give it a thumbs up, like and subscribe to the channel, Knee Pain Guru YouTube channel, turn on notifications for future videos. Got a question that came in. Kara writes here, let me show this. I have Baker cyst and in both knees, mild. Okay. Kara, it's not exactly a question. Baker cyst, it's another expression of the neurology. Tension in the knee, in the leg. Think of it like a kink in the garden hose. Your lymphatic system moves lymph, which is, you think of it like your garbage collectors, through your legs, through your body. And when there's tension held because you're sitting too long, or you fell or had an accident, an injury, a surgery, a trauma, whatever that is, the tension holds in the leg in a certain way that doesn't allow the lymph, in this case in the back of the knee, to flush itself out. So from a neurological perspective, we have to start changing the neurology in the knee, the hips, and the lower back, because the pelvis is the pump of the lymphatic system. Once we do that, then the situation resolves itself. And then Kara continues to write, I have worse arthritis, but they don't have these cysts. So you're losing me a little bit. You can have arthritis and have the cysts at the same time. Arthritis is dehydrated joint. Like all your diagnosis, you look on what you got from the doctor, you go to the doctor, and they write down the diagnosis. The diagnosis will say mild, severe, whatever arthritis, bone on bone, whatever it is, and then they'll say dehydrated joint. That's because The joint squeezes because it feels pain, because there's tension. The neurology is telling the knee to tense up to protect itself, which, if you think about it, the joint's supposed to be lubricated. You got a sponge, and if you had a wet sponge and you tightened up on it like that, it's going to squeeze all of the liquid out of it, which is going to cause the joint to begin to rub and wear. It's a simple understanding of the body, yet it's fundamental to why arthritis develops, why Baker cyst develops, why whatever you have going on. Make sense? If it does, give the video a thumbs up, like and subscribe to the channel. Turn on notification for future videos. Let's see. What is meant that I have mild arthritis and have cysts, but so many others have worse arthritis and they don't have cysts? One is not contingent on the other, Kara. Like, you know, you could just have arthritis, you could just have Baker cysts. And that's a mindset piece that you could have one or the other or both. And the function of getting rid of the arthritis or the Baker cyst is the same. Create comfort in the knee, change the neurology, the body relaxes and lets go, and it creates the conditions that we need to set up through water, nutrition, breathing, mindset, all of those other pieces to support your body's ability to keep the Baker cysts away, the arthritis, the body can begin to resolve it on its own. Is that making sense? Okay, next question. This is from Mason. I had ACL surgery, hamstring graft 2 months ago. I can't get my knee past 90 degrees without massive pain. What would you recommend? Creating comfort. Creating comfort is going to be my answer for everything. Because what happens is when you create comfort, the joint relaxes and the range of motion increases. The body isn't able to fully extend or bend a leg because of tension in the body. The tension as a result of accidents, injuries, surgeries, trauma. When the body doesn't feel safe, it tenses up to protect itself. When it tenses up to protect itself, the range of motion becomes limited. Baseline. That's it. We begin to relax the tension to teach your neurology how to let go of the pain, how to let go of whatever you call it. People get stuck. Oh, my knee doesn't feel pain. It doesn't matter. It's stuck in your neurology. It could be pain or stiffness or tightness, or it feels full. Like, how do you describe your knee? Not how I describe it, how you describe it. And what we're looking is by changing the neurology through comfort, you give your knee a different experience, your hips, your lower back a different experience. You free up what gets stuck in the nervous system as a result of the accident, the injury, the surgery, the trauma. Makes sense? Give it a thumbs up. Doesn't make sense? Ask a question. Okay. So yeah, it's simple. But simple in the sense of we're not talking about complicated stuff, but it's complex in the sense that in order to get the simple, the mindset needs to be different. We have to have a different mindset. We have to adopt a different mindset to realize that pushing through pain will never get you out of pain. Continuing to strengthen your legs when it already hurts will not increase the range of motion to the degree that your knee feels normal. Apples and oranges. We're talking about two different realities. Makes sense? Give the video a thumbs up. Doesn't make sense? Ask a question. Okay. Next question here is from Jill. Had a right knee, total knee replacement 1 year ago last January. I still have screaming pain while bending my knee all the way back. Sound familiar? It feels tight and sore on the outside edge of my knee, which is usually around the meniscus area. X-rays say I have a bone spur hook now on the outside of my knee that is not impinging on my ability to bend my knee all the way back, so my heel touches my butt. From my understanding, After having a knee replacement, your heel will never touch your butt. That's the mechanics of a knee replacement. And many doctors, I've had buddies that after I talked to them, they were pissed because they didn't realize that a knee replacement would not allow them to fully get their heel to their butt again. My father included. Anyhow, another story. Okay, heel touches my butt, cannot sit on my legs or kneel very well. That's what happens when they cut the bones in your leg off and replace it with plastic and metal. We need to hold doctors to a higher level of accountability as to what they are giving you. And that also means you need to up your game in terms of your knowledge and understanding of your body and how you see the role a doctor plays in your life. The days are long gone that we're going to go up and give all of our power to a doctor and say, here, take care of me. I'm not taking part in my own healing process. The doctors are valuable in their area of expertise. Something is broken or torn in the knee. I want to be talking to the doctor as to what my solutions are. If there's nothing broken or torn in the knee, I need to look at how my body is able to heal itself. That's it. If you're looking at it any other way, that's what these videos are for, to start shifting your mindset, because the other one is like you're giving up your power. If you want to do that, that's great. This is not the place for you. Okay. What can I do to help with scar tissue? Bend my knee to allow my knee to bend back. I have more flexibility when I'm on prednesone and have pain almost every night. And this is what happens. The flexibility is not inhibited by the scar tissue. This is important. That almost is kind of inaccurate. You could have scar tissue that is preventing the knee from fully extending or bending. However, what tends to happen is the anticipation of the pain and the trauma that your body has been through limits the range of motion in the knees, the hips, and the lower back. And this tension that exists on a neurological level inhibits the full range of motion in the leg. Scar tissue forms as a way of protecting the knee. Scar tissue breaks down as a result of the natural motion of the knee. But if your body is anticipating the pain, you're not going to go into the full range of motion to allow your body to be able to break down the scar tissue. If it makes sense, give the video a thumbs up. If it doesn't make sense, ask a question. So the piece is creating comfort. Creating comfort changes the neurology, creating comfort in the knee, the hips, the lower back, teaching your body how to recover faster. Instead of focusing on pain, because the reality of it is when you've been in chronic pain for weeks, months, years, sometimes even decades, your mind is in everything is looking for the pain. You don't want to feel the pain. Understand that this has changed how you think, how you feel, and how you move. And if we're only looking on a physical level to change that, like strengthening the muscles in the legs, you'll never get there. You'll never feel normal again, because there's so much underneath the hood, so to speak, that needs to be addressed on a fundamental level in order for the body to let go of the trauma, essentially trauma, that it's holding on to, that will allow the knee to have full range of motion again. Good stuff. With or without knee replacement. I have clients in my coaching programs that, they have knee replacements and they're getting good results. Okay, next question here is from Lee. I just completely tore my ACL. Doctor said half of the people do not have surgery and do okay. Should I do the ligament strengthening, or will that just overstretch the remaining ligament? Okay, there. Just so you know, this ACL tear, that's the injury that I had. Tore the ACL in my left knee. What I was running into is the knee would dislocate. I would move a certain way, and all of a sudden, and I was on the ground and it hurt a lot and it'd swell up and I was in pain for days. So it wasn't a good scene. Uh, it really depends on a couple of things. There are professional NFL athletes who have had entire careers without ACLs. So it's possible. Well, what ends up happening is you're not relying on the ligaments to hold the bones in your knee together. Ligaments connect bone to bone, tendons connect muscle to bone. And what ends up happening is you have to strengthen your leg, the muscles in your leg, to create the stability and support for your knee. So you're not actually strengthening ligaments anymore because the ligament has been torn. So the key is strengthening the muscles, and that would be something you would definitely want to check with, your doctor, your physical therapist, as to how you would want to go about doing that. As far as overstretching the remaining ligaments, this is where you have to be careful, because when the ACL is torn, you can move a certain way and the knee pops out. That was my experience. So it sounds like there needs to be a little bit of research you're doing with your doctor as far as that goes. And you also want to evaluate to get an ACL replaced, and you can do it with patella tendon, your kneecap tendon. You could do it a hamstring graft, and you could also get cadaver, which is they remove it from a deceased person to recreate the ligament in your knee that you've torn. All of those have pros and cons to different degrees depending on what outcome you want. For me, I was in my late 20s. I was competing in judo. I wanted to get back out on the judo mat and throw people. So in my mind, get the ligament repaired, get back out on the judo mat, throw people again. So that was my mentality. I know people adapt their lifestyles based on a ligament being torn, that they no longer do the things that they did before because they don't have the ligament in the knee again, and they understand the limitations of their body. So that's going to be something that you have to kind of gauge yourself as far as what works, your age, your activity level, things like that, in terms of determining whether or not an ACL reconstruction would make sense. Okay. Pravina, hi, I have ACL grade 1 tear. It's been a year. I still have pain when I walk quickly, even though without pain in my knee, swelling persists. What could be the reason? And this goes back to the tension pattern that the body takes on as a result of the injury. When we have an injury, accident, surgery, trauma, in this case, it's just an injury. It's great that Pravina knows that it was a grade 1 ACL tear. Ligaments can heal themselves if they're not fully torn, and if you give it sufficient time to heal. This is where Bill didn't heed the warnings that his body was giving to him, which was the knee was dislocating. I just kept pushing myself because I had this, whatever was going on with me at that time. A lot of ego, a lot of drive, too much testosterone, something like that. Point of it is I dislocated my left knee 4 times and then went to the doctor after the ligament was completely torn and after I tore 2 pieces of meniscus in my knee. If I would have taken a break initially and given my knee time to heal, focus on water and nutrition and supplementation and healthy exercise that wasn't going to push my knee in a way was causing it to dislocate again, it can heal. Now, the healing of the ACL is slightly different than the pain and the swelling because that's a tension pattern that the neurology takes on. So we can begin to address the tension pattern to relax the joint right? Relax the joint. Same for breaking down scar tissue. Same for resolving Baker cysts. Same for addressing arthritis. We want to relax the tension in the joint. So now the ACL is able to heal easier. The joint has more space, which means the swelling can resolve itself. It can move through the joint easier. The lymphatic system can clean it out easier, as well as it's not going to hurt. It promotes the recovery, or it reduces recovery time. Okay, got a couple more questions, but one just came in from the live chat. Kara, can I make my knee stronger and live a pain-free, active life with less meniscus if I follow the right program? Yeah, here we go. Meniscus, if I follow the right program, yes. I did. That's what I help clients online with. Just they're worried that I will always be limited because I am missing what I was born with. It's once we understand on a deeper level how the body works, it's easier for the body to heal. That's the bottom line. Most of us, we weren't taught. I wasn't even taught. I had to kind of screw it up and figure it out along the way as to how the body can heal itself. That's a big piece. And I see too many people struggling, trying to strengthen their legs, causing more pain in the process, trying to push through the pain, causing more pain in the process, trying to continue having this agenda that the knee needs to heal by a certain time and it doesn't work. And they just end up depressed and frustrated and stuck in the same place because we need to take a step back and like look at the landscape of what's going on. Look at what you want in your life, what you want to experience in your life, whether it's playing golf or tennis or running or camping or traveling, whatever that is. And then where are you at? What is your body doing? Where are you struggling and frustrated? And how can we begin to incorporate comfort into your daily life? That'll just take a few minutes in a way that will allow you to begin moving in that direction to achieve your goal. And that is not a narrow in scope process. We have to look at a lot of factors in your life: water, nutrition, breathing, mindset, stretching, strengthening, mobility, neurological re-education. There's a lot of things that we need to look at in order to get you to that place. Without that in-depth knowledge and understanding of what's going on, that it requires us to have, dialogue to get you to that place, because you're going to get stuck. That's the reality of it is. You're going to get stuck. You're going to have a landmine. There's going to be a pitfall. You're going to fall into an old pattern or an old trap or something. You're going to get stuck. And that's when you need someone to kind of help you up to keep you moving along that path. 2 more questions. And then I got a short little clip that I want to play for you at the end. So Razia says this was regarding knee injections. And the blog post that I had on my website was why knee injections don't work. And Razia was complimenting the rooster comb fluid injection was a complete failure with me. It didn't improve my osteoarthritis pain. However, my cousin got great results with the same treatment. I think it's all up to one's body action reaction to the treatment. No harm to give it a try. And I do believe there is a harm giving it a try, because I've worked with clients that have gotten injections in their knee and the doctor hit a nerve on the way in, which actually made the knee worse, actually made the hip worse, actually made the back worse. And if it was only just one instance, I would maybe agree with you. But I've seen it over and over again. This is going on 22 years since my own knee injury that I have been working with clients in person as well as on the internet, that I see that if we can't create comfort by getting the pressure off of the nerves and changing the neurology, then absolutely, the injection, the drugs, the shots, the surgery is always available. We need to empower ourselves by taking that first step and beginning to learn how the body can heal itself, how you can do it yourself in order to get the results that you're looking for. And then Razia continued, osteoarthritis in pain in the knee joint is physical and real. It is not in the mind of the suffering person. It is both places. How about that? The rubbing of two very jagged bones on each other causes a real and horrible pain. You know that. So don't tell us this pain wouldn't or couldn't defeat the sufferers, because it will. It is real and horrible pain if you have a surface level understanding of what's causing the pain in the body. And we can begin to change the neurology with mild arthritis, medium arthritis, severe arthritis, bone on bone. I've seen it. I've done it over and over again, doing this 12 years online, working with clients by creating comfort in the knee and changing the neurology. It's the only way that the pain is going to go away, is by getting the pressure off of the nerves. The shots in the knee are there to lubricate the joint. Lubricate the joint that got dehydrated. Remember, all diagnosis of arthritis is dehydrated joint. The joint gets dehydrated because of the pain you feel, the tension pattern that the body is holding on to, not allowing the synovial fluid to get into the joint to lubricate the joint. They're trying to force liquid into the joint to rehydrate the joint. That can work for a short period of time, lubricate the joint, but if the neurological pattern that is causing the joint not to have the space is not addressed first, then you're going to get the results like you got. Yes, it hurts. Yes, it's in your knee. Yes, it's in your body. Yes, it's in your mind as well. It's everywhere. We can't pluck one part of you and say the other parts don't integrate with it. That's very shallow and narrow-minded thinking. Those are my thoughts. Anyhow, you got questions? Ask them over there. If you make sense, give the video a thumbs up. If it doesn't make sense, ask a question for clarity. Okay, Clara says, great info and thank you for sharing this. Last question, I heard that stretching my quads will bother my cysts. It all depends on if it does or if it doesn't. There's a very simple way of looking at the body. If it hurts, don't do it. And if it doesn't hurt, that's a direction we want to go. Most people think, well, that's like playing the first move of a chess game. There's so much more on the other side of that. I just need to point you in that direction. So this is like great info. You want to know where you go next for this. You can head on over to, where are we? thekneepainguru.com. I got a short video on the homepage you could check out. Tells you more about my approach, the program that I offer, and then I also have a coaching programs, group and private coaching programs that I work with clients, both one-on-one and in a group format, that I teach them how to get their knees out of pain. And I can do it better. And I'll raise my hand, and I can do it better than your doctor or physical therapist in person. I've done this for 12 years online. And if you follow what I say and you give me feedback, I'll get you out of pain. Simple. It's actually very simple. Most people get into a mindset game of not knowing what to look for, either trying to do it themselves, or they begin working with my program and then they disconnect. They go, oh, I don't want to go get on the call, or I don't want to do the homework, or they make excuses, or dozens of different reasons why, instead of reaching out. And that's where the pitfall is. Instead of in that place where you feel disempowered and stuck and frustrated and depressed and all that, it builds up, because getting out of pain is not linear. You have ups and downs in the process. And when you're in a valley, You don't want to do anything. And when you're on a high, you want to do everything. And the key is to discipline your emotions, your mind and your emotions, to be consistent with creating comfort in your knee, in your body, setting up the conditions in your life to support your body's healing process. Without you taking action to do that, you're going to end up in the same place. And Kara, you'll be in the same place next month, 3 months from now, next year, and going, but nothing works. And I see so many people do that. Oh, I like being on your email list. Great. But they're still complaining about the same thing, seeing little or no improvement in their knee, and keep trying the same thing over and over, expecting a different result, which is the definition of insanity. And if that's how you roll, hey, good for you. Eventually, the pain will continue to get worse, and something will change it. And usually you're going down that path of the arthritis getting worse, the Baker cyst getting worse. You get a surgery, it creates more trauma in your neurology. And then you get old enough and you're a perfect candidate for a knee replacement surgery. And the doctors are saying, hey, we can take care of that. I'll saw off the bones in your leg and replace it with plastic and metal, and poof, you'll be good to go. And then I could send you pages and pages and pages of people who have had knee replacement surgeries that are not too happy with them. Okay, here's a video. I'm gonna scoot now. If you got questions, you can type those in the comments section. Here's a cool video about my group coaching program, Meet Club. So thank you all very much for being here. Have a good one, and I'll see you on the next video.